Okay, so imagine for a second a rock, not just, any rock, but one that's somehow inside you, growing slowly, silently, maybe for years. And then one day, bam, it causes this awful pain. You can barely move. Sounds pretty nightmarish, right? Well, for horses, this isn't just some bad dream. It's a real thing. It's called equine enterolithiasis. In this deep dive, we're really going to try and unravel this complex issue, these mineral stones that can form right inside a horse's gut, mostly in the large colon. Our mission really is to figure out the why the causes, how vets actually diagnose these hidden things, what the treatment looks like, which is maybe more limited than you'd think, and crucially, how we can try and prevent them. And you might be surprised by some of this, like how common feeds can be a huge factor, or why, weirdly, where your horse lives actually matters. And this is all coming straight from solid veterinary sources. Okay, so let's unpack this. What is an enteront? My first thought was like a pearl in an oyster. But it's a horse's gut, and it's not starting with sand, but maybe something they eat every day. What exactly we're talking about?
That pearl analogy is actually, it's pretty good because it really is about layers building up. So at its core, an enterolith is a mineral concretion, a stone basically, usually made of magnesium ammonium phosphate. Vets often just call it struvite. And the fascinating part is how they form. It's in these concentric layers, like an onion, all building up around some central thing.
A central thing.
Yeah.
That nidus, they call it, something the horse actually swallow.
Exactly. A foreign object gets in there somehow. And these things tend to form primarily in the large colon. There's even a specific spot, the ampulla of the right dorsal colon, that's kind of a known hot spot for them.
Okay.
Now, small ones, they might just pass through, no big deal. But if they get bigger, that's when you get problems. Partial blockage, complete blockage, leading to colic. And what's really striking is how, normal dietary stuff, things horses eat all the time, can eventually cause such a major issue. It's all down to specific chemical reactions happening right there in the large colon, leading to this exact mineral buildup.
That's quite something. So if it's not random, what really puts a horse at risk? Why do some get them and others just don't? What are the key factors here?
Right, that's the million-dollar question. And it's not just one thing. It's really multifactorial. You've got diet, genetics, environment, even how the horse is managed day to day, all playing a part.
Yeah.
If we dig into diet first, because that's often seen as the biggest piece of the puzzle, alfalfa hay comes up again and again.
Alfalfa. Really? I think a lot of owners see that as good quality hay. Why is alfalfa a risk factor here?
It really boils down to the chemistry inside the gut. Alfalfa is high in protein, it's high in magnesium, high in calcium, and having a lot of those things creates an alkaline environment, basically, a high pH in the large colon.
Okay.
And that alkaline condition, it's perfect for struvite, that mineral we mentioned, to form and crystallize. Studies have actually shown that feeding alfalfa as, say, more than half the forage, that significantly bumps up the risk.
Wow, more than 50%.
Yeah. And just generally, high levels of magnesium and phosphorus aren't great either. Even things like feeding a lot of grain compared to forage or feeding bran might contribute. And there's some talk about hard water, water with high mineral content possibly playing a role too. But the evidence there is a bit less clear-cut than for the alfalfa.
So it's the whole internal environment, the chemistry that the diet creates. That makes sense. And that connects to the geography thing you mentioned earlier, right? Why is it endemic, way more common in places like California or Florida?
Exactly. That geographic pattern really points towards environmental factors, like the mineral content of the soil, the water, and crucially, the forage that's grown locally in those areas. California, Arizona, Florida are the big ones in the U.S. You see cases pop up elsewhere, of course, but the fact that it's so concentrated in certain regions strongly suggests what's naturally in the environment and feed there is a major driver.
Interesting. But it's not just diet and the location, is it? You mentioned breed, too. That suggests some kind of genetic link. Which breeds should owners maybe be more aware of?
That's right. There definitely seems to be a breed predisposition. Any horse can get them, let's be clear. But Arabians, Arabian crosses, Morgans, American saddlebreds. They show up much more often in the case reports than you'd expect. Yeah, and interestingly, while you do see them in minis, quarter horses, thoroughbreds too, thoroughbreds and warm bloods actually seem to be underrepresented in those high-risk areas. So it's complex. Maybe it's genetics, maybe it's partly related to how those breeds are typically managed. We don't know for sure.
And management. Let's circle back to that nidus, that starting point. You said it's a foreign object. What kind of things are we talking about? Anything particularly surprising?
It can be incredibly ordinary stuff, which is almost the weirdest part, like tiny bits of baling twine, small stones, obviously. Sand is a big one. But sometimes it's bits of metal, a lost nail, a screw, pieces of rubber, even clumps of hair.
So it's not that the object itself is causing damage by being sharp or anything. It just sits there.
Pretty much. It just needs to be something the minerals can start sticking to. It lodges somewhere in the colon, and then combined with that alkaline environment we talked about, the minerals just start layering on year after year. Which explains why age is a factor, too. You rarely see these in young horses, like under 2. The average age when they cause problems is usually more like 9 to 11 years old. It takes time for them to grow big enough to cause trouble.
Right, years of buildup.
Exactly. And other factors play in too, like maybe the horse just naturally has slightly slower gut motility, or maybe they just tend to run a more alkaline pH in their hindgut anyway. And then there's management, like limited turnout.
Limited turnout, how does that increase risk?
While horses kept in stalls more, say less than 50% of their time out on pasture, seem to be at higher risk. Grazing encourages natural gut movement, keeps things flowing. Being cooped up more, maybe not drinking enough water too, that can contribute.
Okay, so if these stones are forming silently, sometimes over many years, how on earth do you know they're even there? It doesn't sound like diagnosis would be simple.
You're spot on. It's often tricky. The signs can be really vague, mimicking lots of other types of colic. So vets, especially in those high-risk areas or with those predisposed breeds, need to have it on their radar. The most common sign is that chronic recurrent colic, often kind of mild to moderate. The horse seems painful, maybe gets a bit better with treatment, but then it happens again. The pain can even come and go as the stone shifts position.
Intermittent pain.
Yeah.
That must be frustrating for owners.
Hugely frustrating, and that's why getting a diagnosis is so key. Because catching it before it causes major damage makes a huge difference to the outcome.
And I guess if it fully blocks the intestine, it becomes much more serious.
Oh, absolutely. If an enterolith completely obstructs the bowel, especially the narrow or small colon, then you see sudden, really severe constant pain. That's a definite surgical emergency. Other signs can be nonspecific too, like just being lethargic, off their feed, maybe losing weight over time. One thing, though, that is a strong clue is sometimes owners might actually find small stones in the manure. They look like hard, maybe roundish, or even faceted little rocks. If you see that, you need to call the vet, for sure. That warrants investigation.
Okay, finding stones in the manure, definite red flag. So, if a vet suspects enteroliths, what are the diagnostic tools? How do they confirm it?
Well, doing a rectal exam, the vet can sometimes actually feel a large stone, but they're often too far forward to reach. That only works in maybe 5% of cases. The gold standard for diagnosis before surgery, in adult horses anyway, is abdominal radiography, X-rays. You need pretty powerful X-ray equipment to get through a horse's abdomen, though.
Right, I imagine.
Yeah. But on the X-ray, the enteroliths usually show up really clearly as these dense white shapes. The studies show it's pretty sensitive, around 84%, and very specific, like 96%, though maybe a bit less reliable if the stones are further down in the descending colon. It's definitely recommended for horses with recurrent colic, especially in those endemic areas.
Okay, X-rays are key. Anything else? Ultrasound.
Ultrasound can be used, yeah. It's less great for seeing the stone itself because gas in the gut gets in the way, but it can show secondary signs, like dilated intestine, suggesting a blockage. Ultimately, though, if the signs point towards it, but X-rays or ultrasound aren't conclusive and the colic keeps happening, then exploratory surgery, a laparotomy, becomes the definitive way to diagnose it. You go in and look.
So surgery might be needed just to find out for sure,
Mm-hmm.
which leads us to treatment. If a horse is diagnosed, what happens then? Are there options, or is it pretty much one path?
Unfortunately, when it comes to enteroliths causing obstruction, there's really only one effective path: surgery.
No dissolving them, no breaking them up medically.
Yep. There's no reliable medical treatment that can dissolve or break down these struvite stones once they've formed and are causing problems. Surgical removal is the only way.
Okay, so it's always surgery. Can you walk us through that a bit? What does the operation involve?
Sure. So first, they'll stabilize the horse, manage the pain with NSAIDs, those are anti-inflammatories, give IV fluids, get them ready for surgery. The surgery itself is called a laparotomy. It's done under general anesthesia. The surgeon makes an incision along the horse's belly, carefully brings the large colon out, locates the stone or stones, because often there's more than one.
Oh, really? Multiple stones?
Yeah, it's quite common. So they have to feel through the whole large colon, sometimes even the small colon. Very carefully picture they get them all. Then they make an incision into the colon itself, remove the stone, and carefully stitch the colon back up before closing the main belly incision.
Sounds like major surgery.
It is, and post-op care is crucial. Standard colic surgery, aftercare, pain management, antibiotics, fluids, and then, very importantly, a slow, gradual reintroduction of feed.
You mentioned earlier that the long-term changes are key for success. This sounds like the perfect lead into prevention. Once a horse has had surgery, how do you stop it happening all over again?
That is absolutely the critical question, because a horse that's formed one stone is definitely predisposed to forming more. So prevention focuses entirely on changing those risk factors we talked about, diet and management. This needs to become a lifelong strategy.
Right. So what's job number one on the prevention list? Back to alfalfa.
Exactly. Limiting alfalfa hay is the single most important thing. The recommendation is to keep it below 50% of the total forage the horse eats. Replace it with grass hays, timothy, orchard grass, Bermuda, oat hay. Just increase the diversity away from high alfalfa content.
Okay. Less alfalfa. What else?
Making the diet slightly more acidic might help counteract that alkaline environment. Some vets recommend adding a bit of apple cider vinegar to the feed daily, maybe half a cup to a cup. The idea is to lower the pH in the large colon. Things like molasses or beet pulp might also help slightly acidify the hindgut.
Apple cider vinegar. Interesting.
Yeah, it's a common recommendation. Also, obviously, avoid giving extra magnesium or phosphorus supplements unless there's a proven deficiency. And if you happen to have very hard water, looking into water softening might be worth considering, although that can be practically quite difficult.
Makes sense. And what about the management side?
Yeah.
Preventing that nidus from getting in and keeping the gut moving.
Absolutely critical. Maximize turnout time as much as possible. Let them graze. That promotes gut motility naturally. Feeding smaller, more frequent meals rather than one or two big ones can also help digestion. And think about how you feed hay. Using elevated feeders or hay nets is much better than feeding off the ground, especially sandy ground. That minimizes the chance of them accidentally swallowing sand, dirt, little pebbles, or bits of twine, all potential needy.
Right. Keep the feed clean and off the dirt.
Exactly. Some people use psyllium supplements too. While that's mainly targeted at preventing sand colic, it can help with overall gut motility and potentially help move any ingested debris through before it settles and becomes a nidus. And just regular exercise is good for gut health too.
So lots of practical changes owners can make.
Definitely. And if you have a horse from one of those predisposed breeds or one that's already had a stone, you just need to be extra vigilant with all these preventative measures.
Okay, so let's talk outlook. If a horse needs surgery for an enterolith, what's the prognosis generally like? Is recovery usually good?
The prognosis is actually, generally speaking, good to excellent. If it's caught and treated before the intestine gets severely damaged or, worst case scenario, ruptures. Survival rates for elective surgery where the gut is still healthy are typically quoted as being greater than 90%. Most horses, once recovered, can go back to their previous job, whatever that was.
Over 90%. That's fantastic news, really encouraging.
It really is. Colic surgery has come a long way. And it's a big but we keep coming back to recurrence. The risk is definitely there if those dietary and management changes aren't strictly followed, lifelong. A horse that makes stones is likely to keep making them if the conditions inside the gut remain the same. Successful surgery is only half the battle, truly. Diligent prevention is the other half.
And the main complication to worry about is rupture.
Yes, intestinal rupture is the most serious complication. Thankfully, less common with large colon enteroliths compared to small colon ones, but if it happens, it's uniformly fatal. That's why timely diagnosis and surgery are so important.
Okay, so wrapping this up then. Equine enterolithiasis. It's clearly a serious, complex condition. It's this interplay of diet, especially alfalfa, geography, breed, management, all coming together. But the really positive takeaway seems to be that if it's caught early, the prognosis with surgery is very good. And prevention, focusing hard on limiting that alfalfa and maximizing turnout, is absolutely key, especially for horses that have already had one. It really makes you think, doesn't it? Next time you watch a horse grazing, or maybe even think about your own diet, just remember that incredibly intricate link between what goes in and all the complex hidden processes happening within. Health, really, in any living thing, is always a deep dive into those details.